We are now seeing absent ACL over the lateral medial wall of the lateral femoral condyle. You can see that guide wire has been passed to the most inferior and posterior part of the uh, condyle. You can see that drill bit is being now used to make the drill or tunnel in the femoral part. So now femoral socket is now being prepared. After femoral socket is now being prepared, you can see that we have passed the passing sutures. This is a view from the medial portal to assess the femoral socket. We have drilled now 2.5 mm, 2.5 centimeters of the femoral socket, and we are now able to see a very thin bone is remaining behind the femoral socket. This confirms the best position of the femoral tunnel. Now we are seeing we have now passed the guide wire for the tibial socket. Now this is a flip cutter. We are doing all inside ACL. Now we are opening the flip cutter and making the tibial tunnel inside out. Now after the tunnel is prepared, the flip cutter blade is now closed and now guide wire will be taken out from the tibial end. With the bead pin, we are passing the passing sutures from the tibial tunnel, and these passing sutures will be taken from the anteromedial portal, which would have made widened in order to pass the graft from the anteromedial portal. You can see that loops are both taken once with the suture retriever in order to make sure that no intermediate soft tissue tag is there. When we pass the graft, there should not be any soft tissues obstructing the graft passage to the femoral and tibial side. You can see that we are cross-checking twice to confirm that there is no soft tissue tag. Now, femoral side adjustable loop tightrope is being passed, and now this is being checked. Again, this is the marking. Now, the button is being checked from the medial portal, and it is passed from the accessory anteromedial portal. Now, the button is now being deployed from the femoral lateral cortex, and marking is confirmed. Once the femoral side button is deployed, we will be pulling the graft up to 2.5 centimeters. Now the graft is very shiny, perfectly prepared. Graft is now going into the femoral socket. After the graft is now in the femoral socket, after adequate length, we will now be exchanging the loop of the tibial side with the other end of the adjustable loop tightrope. You can see that now with the loop we are pulling the graft, and now the graft will go into the tibial side socket inside, which is coming from the accessory anteromedial portal. After we pull it, you can see that now the graft will be passed from femoral to tibial side. This completes the graft passage of the all inside ACL reconstruction. Once the graft is completely passed from tibial and femoral side, the button from the tibial side will be tightened up to the cortex of the tibia, so that the button of femoral and tibial side both will be tightened, and the graft will be secured with the adjustable loops of both sides. That is the principle of all inside ACL reconstruction, where we are not using any screws. Now you can see the tension of the graft is very good, and the graft position, graft diameter, and the graft is perfect. This completes all inside ACL reconstruction. Thank you.